So good afternoon. Today we're going to be talking about our ongoing COVID-19 testing efforts and a new initiative to improve access to testing in communities that need it most. But first I want to provide my daily update on COVID-19 metrics. Yesterday the state reported over 7,200 new individual tests for COVID-19, and in total we've now done about 1.1 million tests across the Commonwealth. Yesterday, there were 140 new positive cases to report. That brings the statewide total of positive cases to 104,799. The 7-day average for positive tests remains at about 1.9%. That's the number it's hovered at, a little bit below 2% for the past few weeks. The positive test rate has dropped by 93% since the middle of April. There are currently 621 patients hospitalized for COVID-19 in Massachusetts, and around 100 of those are in the ICU. Those numbers have been pretty constant for the past several days. The 3-day average number of patients in the hospital is down by 83% since the middle of April, and as of yesterday, there were 5 hospitals using surge capacity, although I think most of those were not related to COVID. Yeah. Overall, the public health data continues to show a downward trend on many of the key metrics, and the progress we've had there is enabling Massachusetts to reopen on a phased basis while continuing to contain COVID. With respect to today's announcement on testing, I think as everybody knows, testing is one of the critical tools in the toolbox that we use as we continue to fight and contain COVID. It helps us identify where the virus is present and allows us to trace and isolate positive cases in a targeted way. Testing will remain a crucial tool in the months ahead. Last month, we submitted a comprehensive plan to access federal resources that could support continued and expanded testing here in Massachusetts. The plan focuses on boosting our testing capacity and providing on-demand access to testing for symptomatic individuals and their close contacts. This strategy is crucial to containing the virus even as we reopen the economy so that we can monitor exactly where new outbreaks occur so that they can be traced and contained. The plan we filed last month also prioritized increased testing for vulnerable and high-risk communities, nursing homes, folks in the 24/7 care delivery business for folks with developmental disability and mental health issues, and emergency response providers. We've made a lot of progress in fighting COVID-19, and today, as I said before, that 7-day positive test average stands at about 1.9%. However, not all communities have experienced that same rate of decline with respect to the prevalence of COVID. And that's why today we're announcing a Stop the Spread testing initiative, which will begin on Friday, July 10th, and run for the next 4 or 5 weeks. No one needs to rush to any of these test sites. They're going to be open and available to people, as I said, through the middle of August. We're launching this program in 8 specific communities where the prevalence of COVID-19 is above the statewide average and where we've seen a decrease in testing volume since April. The goal of this initiative is to provide widespread asymptomatic testing in an easy-to-access location within these communities. Increased testing within these communities will help to identify new cases of COVID-19 and help stop community transmission. It will also provide people with a certain sense of comfort if they do believe that they may have been exposed or otherwise believe they need to be tested. The 8 municipalities selected for these free testing sites show the most specific need at this point in time based on 4 metrics. We analyzed data from all 351 cities and towns, looking for areas that had elevated total spread, elevated spread over the past 2 weeks, high positive test rates for the past 2 weeks, and declining test volume since the end of April. This initiative will be launched at the end of this week in Chelsea, Everett, Fall River, Lawrence, Lowell, Lynn, Marlborough, and New Bedford. The testing initiative, as I said, will run for 4 or 5 weeks in these locations, and we urge people in these communities to take advantage of the availability of these test sites, even if they don't have symptoms. Collectively, these communities make up approximately 9% of the Massachusetts population, but have seen 27% of the Commonwealth's positive tests in the past 2 weeks. The statewide positive test rate over the past 2 weeks, as I said before, is a little under 2%, but in these 8 communities, 8% of the tests there have been positive. That includes some individuals who've had multiple positive tests. Despite the continued elevated spread in these communities, total testing in these communities has actually declined by about 40% since the end of April. By boosting testing in these communities, we can more effectively drive contact tracing efforts and support there. This will enable people who test positive to appropriately isolate with supports. It will give them somebody they can talk to about how to manage their time during this period, and it will also help us trace their close contacts and encourage those folks to get tested and to then isolate if they test positive with supports as well. As I said, the initiative will run for the next 4 or 5 weeks, which is basically going to run through the middle of August. During this time, we'll continue to monitor the data closely to evaluate the impact of this initiative, and we'll also continue to closely monitor other communities. If there's evidence of an increase of positive tests in other communities, we'll look into expanding this initiative to those communities as well. Residents of these 8 communities can visit mass.gov/stopthespread to find out where testing in their communities will be available. Some locations will be in brick and mortar sites, and others will be mobile vans that will be located at various sites throughout those communities during the week. We'll be advertising this information in 6 different languages to help get the word out across these communities. We're hopeful that this new effort will build on our strong commitment to sustaining Massachusetts' role as a national leader in COVID-19 testing. We look forward to seeing how this program will support people in these communities that continue to be hit hard by the virus, and anticipate that that knowledge can be used to help them, to help their healthcare community, and to help municipal leaders in those communities as we all work together to continue to contain and fight the virus.